So welcome everyone to this webinar. It's a hybrid webinar held from Brisbane and with presentations from other parts of Australia as well. And certainly the moderator, who I'll introduce soon, is based in Melbourne himself. So this is another one of our OPAT HITH masterclasses. And this one has been specifically designed by our advisory committee to focus on the way that OPAT and HITH services have evolved with the presence of the COVID-19 pandemic and the opportunities that has presented, as well as the challenges that it's presented. So this is organised, of course, by CRE Respond, which is an NHMRC funded Centre of Research Excellence, which focuses on optimisation of antimicrobial therapy for patients with very serious infections, which of course, many of the patients who fall under these OPAT or HITH programs definitely fall under. This seminar tonight, just like our entire program, wouldn't be possible without the sponsors that support this program. And so I'd very much like to thank Pfizer, Gilead, Baxter, MSD, as well as our academic partners at the CHU Nimes, which is the academic hospital in Nimes, for their support of our education program. I'd like to provide an acknowledgement of country and on behalf of the University of Queensland, acknowledge the traditional owners and their custodianship of the lands on which we meet. In Brisbane, that is the Turrbal and the Yagara people. We pay our respects to their ancestors and their spiritual descendants who continue cultural and spiritual connections to country. We recognise their valuable contributions to Australian and global society. So my name's Jason Roberts. I'm the Director of CRE Respond, and I'm really just providing the opening for tonight. The moderator for this evening will be Associate Professor Ben Rogers, who's from Monash University in Melbourne and has a fantastic track record as a clinician, as also a researcher in this specific area that we're referring to. So we're very fortunate to have Ben moderating tonight's program. And as you can see, the rest of the program with Dr James Pollard from Cabrini Health, Lydia Upjohn from Monash Health, and Kate McCarthy from the University of Queensland, as well as the Royal Brisbane Women's Hospital, provide excellent speakers on this really interesting topic, which I hope that we'll be able to go into a lot of detail about through those presentations and also through the subsequent question and answer session that we will host after the individual presentations. So now I'd like to introduce Associate Professor Ben Rogers. Ben is he's a good friend who lives in a different city, but is someone who I'm really grateful to be able to seek his counsel out on many different issues, and certainly someone who has moderated for these webinars in the past and always does an outstanding job. He's also been a presenter as well. His research areas include clinical trials of bloodstream infections, the epidemiology and treatment of multi-drug resistant bacterial infections, as well as optimising use of outpatient parenteral antimicrobial therapy, which indeed forms the expertise that he is able to provide as moderator for tonight. So now I'm going to hand over to Ben to introduce our first speaker and then allow James Pollard to then give his presentation. So Ben, can I ask you to introduce Dr. Pollard?
Look, Jason, thank you so much for the kind introduction and inviting me to moderate tonight. And also, thanks so much to all the sponsors who keep this excellent program happening over and over again. Now, very excited to introduce James, but just first question. So we've got a question and answer session at the end where we've got a good period of time and hopefully there'll be some interesting discussion. But feel free to, pop things up in the chat during the talks, and hopefully we can get to them at the end if it's not something that we address kind of across the talks.